So forgive me for that. You'd think that 3 years into the pandemic, we would have the ability to sort of control all of these things, but it is my absolute pleasure to be with you this morning. And I really want to thank the Fundación Santa Fe de Bogota Urology Service Masterclass for the opportunity to present to you today. These are my disclosures, none of which are relevant specifically to this presentation, with the except for the fact that I am an associate editor at European Urology. And a lot of what I'm going to present to you is informed very much by my experiences in that role. So here's the brief. The question is, how can we optimize our success of publishing in the peer-reviewed literature? And I specifically want to speak today about how we can improve the quality of what we present, and in doing so, by improving the quality of how we write about our studies, improve the significance and impact of the work that we have done. And I also want to spend some time thinking about how to maximize the efficiency of writing, because as I'm sure you all realize, we are incredibly busy as clinicians and researchers, and it's absolutely imperative that we turn up the efficiency with which we can produce our manuscripts and also shepherd them through the editorial process. And I do want to talk a little bit about giving you a bit of a peek behind the curtain of the editorial review process, so that you can understand a little bit more about what happens kind of on the back end as the manuscripts are being evaluated. So I'm going to start a little bit by just actually giving you a view of the state of reporting in the urological literature, because that really does inform where this call for improving the quality of our research comes from. And specifically, I'm going to go through a couple of guidelines that can facilitate the reporting of your research in a very transparent and high quality fashion. Specifically, we'll focus on the consort statement. I'll talk to you a little bit about different checklists for different study styles, and then we'll really dive into improvement of the efficiency of the actual writing process. And I'll give you some tips and tricks for how to convey your results in a way that will optimize your success. And then I also want to talk a little bit about the peer review process and some final thoughts about sort of the editorial process. And I am going to focus, for the purpose of today's presentation, on the presentation of clinical research. Obviously, there are other guidelines and sort of thoughts in terms of presenting translational and basic science research. But for the purposes of today, I am specifically really focusing on how to improve the efficiency with which you convey your clinical work. So I'm not sure how many of you are familiar with Atul Gawande, but he is an endocrine surgeon from Harvard who's written a number of really important and helpful, I think, books, one of which I think is really, we can draw a lot of lessons from as we think about how we present our work, which is called the Checklist Manifesto. And in this book, he wrote one of the sort of key sort of assumptions he makes is, we're besieged by simple problems, and checklists can provide protection. And I'm going to show you a little bit about how that can help in presenting your research. So I'm sure you're all very familiar with the levels of evidence. The sort of lower levels of evidence stem from expert opinion, anecdote, case reports, and personal observations. But as we increase the rigor, the methodologic rigor that we enforce upon our studies to reduce the impact of things like bias and confounding, we move towards the level 1 evidence, which are predominantly made up of randomized controlled trials and also meta-analyses of similar trials. But I would pose to you the question, I'd like you to ask yourself whether or not all level 1 evidence is truly the same. And so let's take a step back before we get into this and really think about the quality of evidence that's been proposed and presented in the urological literature to date. And I'll start with a bit of a case study looking specifically at randomized controlled trials. So in the early 2000s, there was a concern that a lot of the studies that were being presented in our literature suffered in terms of the presentation quality, and that impacted our ability to utilize and draw from that research experience, and then ultimately to improve the quality of care. So a couple of studies looked specifically at just the reporting of the trials. Now, I'm not talking about how the trials and the studies were carried out or the actual methodological rigor of the research. I'm talking specifically about the reporting. So, for example, in some of these early studies, looking across both urologic studies, but also general medical literature. When researchers tried to evaluate whether or not the way that studies were presented, whether or not we could understand how patients got into different treatment groups, or how primary endpoints were defined, or even how sample sizes were calculated, many of the manuscripts failed to report those key pieces of information. And so Chuck Scales and Philip Dahm undertook a similar exercise in the urologic literature. In 2007, they compared manuscripts that had been published in 1996 to those that had been published in 2004. They looked specifically at randomized controlled trials, of which there were actually very, very few in our literature at that time. Only about 4% of all papers that had been published in those two one-year periods met their criteria. And they graded these papers using the CONSORT criteria, which again are a set of guidelines for reporting clinical trials. And we're going to deep dive that in a second. And what they found was in 1996, most studies only reported about 10 of the 22 sort of possible features that are included in the CONSORT guidelines. And by 2004, we weren't doing much better. Most studies, the median number of guideline recommendations that were successfully reported was only about 12 out of 22. And they noted that really there were some improvements, but we still are reporting the frequency of the critical items that are necessary to transparently report a clinical trial in less than 50% of all papers. And similarly, looking, for example, at AUA abstracts that were accepted at and presented at the national meetings in 2002 and 2003, the vast majority of the abstracts did not contain the key and critical information necessary to transparently report those studies. So, for example, very few reported anything in the abstracts with respect to how patients were allocated, randomized, or whether or not the studies were blinded. And in fact, only a third of the abstracts actually reported whether or not these were even true. These were randomized controlled trials. They identified them as trials in the title. And so this is actually really critical, because the abstract, of course, is how many reviewers and readers and member of the folks who are consuming the literature identify the critical papers that they want to read, cite, and learn from. And so if we don't provide that information in the abstracts, it makes it harder for our readers to find our work. Similar methodologic reporting assessments have demonstrated key deficiencies in how we report randomized controlled trials that have evaluated devices, as well as whether or not we're appropriately reporting harm in our abstracts. And updates in 2013 did demonstrate that we were doing across the journals. We were generally doing better. So there were statistically significant improvements in the number of guideline points within the CONSORT guideline that were being reported across the 3-year periods. If we compared those initial two reporting periods of 1996 and 2004 to 2013. However, while we were, for example, doing much better in terms of generally reporting flow diagrams to show the progress of patients through a clinical trial and their assortment and allocation into different arms, and also ensuring that researchers were reporting, for example, the intention to treat analyses. In general, many of the critical details specifically about randomization and allocation were still being underreported and only reported in, at most, about a quarter of all papers. Importantly, of course, there's been a relative explosion of not only observational studies, which can be similarly graded using a different grading system, and assessments of the quality of the reporting of observational studies similarly demonstrates critical deficiencies in the urologic literature. And especially recently, we've seen a vast increase in the number of publications of systematic reviews. And the fact of the matter is, many of the systematic reviews that are published actually generally are not reported in such a way that we can adequately assess the quality of the work. And ultimately what this means is that the work has relatively limited impact in terms of the ability to provide data that ultimately can change practice. And so why does reporting matter? Well, practicing evidence-based medicine, which is the critical and key goal that we aspire to requires high-level evidence. That evidence has to be presented in a way that is transparent, reproducible, clear, and complete. And even methodological studies that are ostensibly performed at the highest level of rigor, where the methodology is such that we are attempting to reduce the impact of things, potential threats to the validity of the studies, like bias, like confounding. If they're not reported in a methodologically rigorous way, they actually can yield biased results. And now, very importantly, the vast majority of journals, especially in urology, include assessments of reporting quality when papers are reviewed. And if you look at the most recent guidelines that have now been accepted by a number of the major urologic journals, they actually mandate that when papers are presented, they follow existing reporting guidelines to ensure the transparency of the work that is being presented. And while these guidelines don't necessarily say how we should do our research, by following the reporting guidelines, we can sometimes actually reveal deficiencies in the study design that can be important in terms of helping us ensure that we are providing the maximum and the best, we're performing our research at sort of the highest level. And this, of course, indirectly has has implications for impacting and improving both study design and how we conduct our research. So importantly, without this transparent reporting, we can't necessarily judge the reliability, nor can we judge the internal and external validity of trial findings. And it's also, especially in this world where we are increasingly seeing a high number of systematic reviews, we can't necessarily extract the information from trials if that data is not reported. And importantly, as I said before, inadequate reporting and design are associated with potentially biased estimates, which then has implications for how we utilize that data to change practice. And it is an absolute truth that the whole of medicine really does depend on the transport reporting of clinical trials. So let's talk a little bit more about the consort statement. So the consort statement was first published in 1996 as a set of guidelines for reporting parallel group randomized controlled clinical trials. These guidelines have subsequently been iterated several times, and it's essentially a checklist of the essential items that should be included when one is writing one's clinical trial. The core or the hub or the heart of the consort guideline, the consort checklist, is what's called the consort diagram, which is a flow diagram of participants as they move through a trial. And I will say that there are build-outs and other modifications for specific other trial designs. So for example, if you have a clustered randomized controlled trial or a non-inferiority trial, there's other pieces of data that you have to report. But these extensions are all available on the website. And now at this point, over 400 journals endorse the consort statement and mandate that when someone is writing their trial, that they actually include a statement of how they've ensured that they've included all the primary components of this checklist. Now, it's really important, though, that this is not, the consort statement and similar guidelines, analogous guidelines, are not meant to standardize how you report your work according to some rigid structure where this sentence imparts this piece of data, and this sentence has a noun, a verb, and an adjective in this specific order. Indeed, when you write, the format of your article will necessarily abide by the journal style that you're submitting to, the editorial directions, and also the traditions of your research field, and truthfully, your preferences too. But the important thing is that the checklist makes sure that you include all of the necessary information somewhere so that your reader can actually judge the validity of your work and also understand the degree to which your work should impact how they ultimately modify their research, what questions they ask, and modify their clinical practice. So let's just take a couple of examples of the simplest pieces of the consort statement. So the first thing that the consort statement addresses is, if you're reporting a randomized controlled trial, the title should include identification that your study is, in fact, a randomized trial. And then furthermore, that there's a structured summary of the trial design, methods, results, and conclusions presented in the abstract. Now, these seem relatively straightforward and simple, but as Dr. Gawande writes, checklists provide reminders of only the most critical and important steps, the ones that even the most highly skilled professionals using them could miss. And so, for example, when you report a trial, you do want to help your reader find the fact that you have used a randomized clinical controlled trial methodology to assess the question that you're investigating. And indeed, the structured abstract is actually an incredibly dense document that has to include and exist as a standalone document, necessarily imparting to your reader all of the critical components of how you did your work. And this is important because, as you know, the abstract and the title are the two pieces of your work that the vast majority, that the most people are going to interact with. It's when you're doing your work in the evenings at the end of a clinical day, and you're looking for references to either support a grant or to support the paper that you're writing, where you first assess a manuscript for whether or not you're going to cite their findings. One necessarily reads the abstract. So if the abstract doesn't have the information that allows your reader to find your work, then unfortunately, you're limiting the number of people who are going to interact with your findings. So it's really critical that the abstract is well written. And then here's just a little bit more information about that participant flow diagram. So really, again, with the flow diagram, what we're doing is we're making sure that our readers understand how patients were enrolled into the study, how were they assessed for eligibility, and how many were assessed for eligibility. Of the people who were not eligible, how many were excluded, and why were they excluded? And then how many were randomized, how many were allocated to the different groups, and then how many patients received the treatment or the intervention that we're studying. Were patients excluded, or did they fall off the trial at any point? And ultimately, how many were available when it came time for analysis? So here's a couple of examples, and I've just taken these from the literature. So this was one trial that was published in European Urology, that when it came time to understand why certain patients did or did not receive the treatment of interest, which was here a pelvic lymph node dissection, the flow diagram actually leaves something to be desired, because we are missing some critical information about why, for example, some patients were excluded. So the meaning of the word misinformation, for example, or intraoperative decision making, the clarity of that needs to be specifically and transparently communicated, because that helps us to understand, for example, if there was some sort of systematic bias that was introduced in how patients were receiving the intervention that we're studying. That has implications for internal validity as well as external validity or generalizability. For example, a much more clear assessment flow diagram is presented here in the IMvigor 010 study, which really demonstrates who did and did not receive the treatment, and then ultimately, for example, down here, not only who completed the treatments, but if they discontinued, why they did, whether it was for disease recurrence or adverse events. And I'll give you another example. This is the POUT trial that was presented, looking at perioperative adjuvant chemotherapy in patients with upper tract urothelial carcinoma. And you can see this incredibly detailed diagram that shows the flow of each individual patient through the trial, including, for example, crossover, which again is really important when you're adjudicating the validity of the work. And then the consort checklist basically is sort of a final supplement that you should include when you're submitting your paper to be evaluated, where you simply don't have to in any way highlight that you're including the checklist within the body of the manuscript, but it's just as a final supplemental figure. You basically include this checklist and just say, here, I've reported all of these key critical pieces of information and what page you've reported them on, and that helps your reviewer ensure that you're actually meeting this guideline. Now, of course, we're not all writing randomized controlled trials, but there are similar or analogous checklists or statements for the different types of clinical research projects that you might be undertaking. So, for example, for a systematic review, we report the PRISMA statement. Observational studies, we can adhere to the STROBE statement. Patient-reported outcome measures, there's the Cosman statement, and there are similar and analogous statements for survey studies and evaluations of surgical innovations. But let's change now. Let's change our focus now a little bit. And now that we sort of understand the guidelines that are out there to help us ensure that we are maximally reporting our research according to the highest quality, in a way that is high quality and very transparent, I want to actually talk a little bit about the strategy of manuscript writing. So in real life, research is sometimes a bit of a messy proposition. You start with your idea, but as you know, things happen, whether there are challenges in accrual, or perhaps we for example, in the last couple of years have a pandemic that impacts how we're able to collect data. And sometimes in the course of doing a study, we have to change courses, change tactics, troubleshoot, problem solve. But ultimately, when it comes time to present your research, what you show your readers, reviewers, and editors is a really clean, well-organized summary of how you did your work and what you learned. And the way that I sort of describe this to my trainees is we walk our readers proverbially down the garden path. In terms of the approach to a manuscript, at this point you're all very familiar with the different necessary components to the manuscript that you're ultimately going to submit for review to the journal of your choice. But I would suggest that when it comes time to write, the way in which you sort of attack or target the writing process, you can actually substantially improve the efficiency of doing so by changing the order that you tackle each and every one of these components. So, for example, this is the way that I think about writing a paper. So when I think about what is the heart of a clinical study, the most important piece of what you're communicating is the data. And so before I set pen to paper in my Word document and start writing anything down to describe my results or describe my introduction or write down how I would discuss my findings, the first thing I do is I spend a lot of time making sure my tables and figures are in publication ready format. Once I have the tables and figures in a way that I feel includes all of the necessary data that I'm hoping to present to my reader, I then from that use that as my roadmap to basically write my results. And then oftentimes in parallel or immediately afterwards, I then go to my methods, because once you have your results fully written, the methods really need to basically mirror the results. And as for each result that is presented, you then have to think about, well, how did I get that information? And that's really what comes out in the methods. Only at that point, once my tables and figures, results, and methods are completely clean and presented, do I go back and write down and formalize my introduction, discussion, and conclusions. Because importantly, sometimes when it comes time to sort of do your full data analysis and write down your tables and figures, you may realize that one, you may have to reject the null hypothesis, and what you thought you were going to find may not be the case. There may have been something important and interesting and that you weren't expecting to find that you want to make sure you highlight. And the introduction and discussions necessarily need to sort of set the stage for that, for introducing that finding, but also contextualizing your key results. So the worst thing in the world is to write a discussion based on what you thought you were going to find and then look at your data and realize that you've got to go back and rewrite the entire thing. So from an efficiency standpoint, I think this really helps to maximize the efficiency of the writing process. And then at that point, your references, now I use a reference manager, so my references are going in as I'm writing. That will come at the very end, and then you'll formalize it into the format for the journal that you're submitting to. And then at that point, I think it's fine to do the title page and the abstract. But of course, you don't want to do your abstract until you have all of this completed. Because again, your abstract has to stand alone and convey all of the critical components of everything that you've included in these different aspects of your manuscript. And some of this might be controversial. In fact, I presented this at the European meeting a couple of years ago, and it actually sparked quite a bit of debate because everyone handles their manuscript preparation a little bit differently. But I will say that this is, in my view, I think the most efficient way to write a paper. And so let's just go through the different components of how we write manuscripts. I want to start with the introduction. So a good manuscript introduction will provide the background data for your study. It'll identify the knowledge gap, and it'll state your study objective. But a great introduction does a little bit more than that. So in a great introduction, you provide only That information which is mandatory and critical, that background data that absolutely sets the stage for your study and provides your reader with an understanding of exactly what knowledge gap you're assessing. So that knowledge gap is critical because that's what your reader is trying to understand. Do I want to read this article? Is it going to provide the information that I am seeking? And then the other important thing here is you are stating the significance and the impact of your work. And a great introduction will state that clearly. In your introduction, you want to clearly and succinctly state your primary objectives and any secondary objectives or exploratory analyses that you propose to undertake. And then I think it's very helpful to always state the hypotheses that you tested. In terms of strategy, I like to keep it very simple. So I think that in general, an ideal introduction is short, sweet, and to the point. So paragraph 1 is really where you define the problem. Your first sentence, it's a highly detailed background, but it's incredibly focused. So this is where you set the stage for the problem that and define the problem that your paper is seeking to address. Sentence 2 provides a little bit more context, and oftentimes is necessary to refine or provide some additional information so that your reader really can understand the background. And then sentence 3 is very straightforward. That's the knowledge gap. What is the question that we don't have the information about? That's your punch. And then why it matters. That's your impact. Once you've defined the problem in paragraph 1, paragraph 2 is where you explain to your reader how your study is going to provide the solution to this problem. This is where you state your primary and secondary objectives and then the testable hypotheses that you undertook. So I'm not sure if you've heard this saying before, but I always think back on this when I'm thinking about writing an introduction myself. High impact introductions are short and sweet. You maybe only have somewhere between 2,500 and 3,000 words in an average manuscript for the vast majority of journals that are out there. And so you don't want to waste time with your introduction. You don't want to waste words. You want to save those words for your methods and, of course, your results. And so Blaise Pascal, who was a French mathematician, he said, I would have written a shorter letter, but I did not have the time. And the truth is, writing things that are short and sweet take a lot of time and a lot of editing because the words become so much more important and you really want to craft your argument. I would say an ideal introduction is pretty short and sweet. It should only be about 300 to 500 words, maybe 2 to 3 paragraphs. You want to, again, save your words for actually discussing the data that you collected. And I think in terms of common pitfalls, I think the one thing that is I see a lot when I'm reviewing papers is that patients or writers start their manuscripts with a lack of focus. They cite unnecessary basic statistics that potentially may be overly general, and especially if you're writing for a focused audience, like many of the urology papers, with urology journals that are out there, you don't need to cite data that is well known to all urologists. You need to cite really just the key statistics that underpin the knowledge gap that you're seeking to address. And this matters because time is precious and the reader needs to understand quickly and efficiently if the knowledge they're seeking is in your paper. So let's just take an example. Let's say you're writing a manuscript addressing the complications of radical cystectomy and bladder cancer. This is the way that I would say about 90% of the papers that we receive start. In 2021, an estimated 84,000 patients will be newly diagnosed with bladder cancer and about 17,000 will die of their disease. Now, that's a critical fact about the prevalence and the magnitude of the problem of bladder cancer, but it doesn't address the question that you're looking at. So let's take a second option. How about this? Despite recent advances in surgical technique and perioperative optimization, radical cystectomy remains a highly morbid operation and is associated with major complications in 25 to 50% of patients. So now we know exactly what it is that we're going to be discussing. We've focused the reader's attention on the knowledge gap that's critical that your paper is going to seek to address. I would also say it's important to make sure you don't start discussing the results or contextualizing your findings. You don't want to include unnecessary details about either your methods or your results too soon. That will go in the necessary sections. You don't want to provide any unnecessary context because that simply makes it hard to understand what's the question that you are targeting here. And then I think it's a sign of respect. And it shows that you have spent a lot of time. It conveys the amount of time and the work that you've put into your research to date to ensure that you're writing in a high quality way. So proofread. Make sure that your sentence structure is appropriate and that you avoid unnecessarily long or windy sentences that can be hard for readers to follow. I also think it's maybe an act of kindness to avoid too many abbreviations, especially if you're writing about something that you may have a lot of familiarity with, but may be something that is perhaps not going to be as familiar to many of your readers. If you start writing in basically code with too many abbreviations, your reader will spend as much time decoding what you're writing as they will understanding the meaning of what you're writing. And it actually makes it harder for people to interact with your work. So in general, I think about making my reader like me, which means I need to write in a very focused, simplified fashion that conveys my points that I'm trying to get across as clearly and concisely as possible. So, pro tips for the introduction: you want to make it clear, make it focused, and make it interesting. And then again, in this goal of creating an introduction that is incredibly succinct and transparent with just the appropriate amount of detail, you're helping your reader find your data, and you're making it easy for your reader and your reviewer to understand what your paper is going to tell them. In this day and age, we all know how many papers are being published on a daily basis. And so there's been kind of this explosion of the literature. You want to make sure that as many people as possible are going to interact with your study, which means that your title needs to be clear and help draw people to your work, and the introduction needs to make it very clear that they should be reading your paper if they're to seek to understand what your key findings were. So let's jump from the introduction now to the results. So when I think about the anatomy of the results, as I said, I think it all starts with your tables and your figures, but then the results text and the text of the results within the abstract all need to necessarily follow in a very synergistic fashion. So again, here, the first question your results have to answer is, who is your study about? And so when I think about sort of the setup, your figure 1, which is again that patient flow diagram, your strobe figure, your consort diagram, this is where you show and clearly convey the inclusion and exclusion criteria, how patients came into your study, how they flowed through your study, and how they exited your study. And this is important because at the end of the day, if we're trying to assess external validity and generalizability, we need to understand that, for example, the patient population you studied is analogous to the patient population I'm taking care of, and therefore I can apply your findings to my group. Or if not, what are the key differences and how could that impact how I apply the information that you're presenting to my patients? So again, here are just some examples of these different patient flow diagrams as we've already discussed. The first table in your paper is going to then present more details about the patients that you included, so the clinical, pathologic, and demographic characteristics. And then in table 2, that's when I think about providing information about the exposure variable or the independent variable of interest, the thing that you studied. Whether you're looking at, obesity as it impacts complications, or whether you're looking at patients who received a specific drug, that's where you detail, for example, dosing of drug, exposure, number of cycles of chemotherapy received. Tables 3, 4, and 5 then describe the response or the dependent variable. These are going to be your unadjusted or univariate analyses in some cases, or if you have the power to do adjusted multivariable analyses, if you're presenting survival figures such as Kaplan-Meiers, this is where those are going to go. And then again, as I mentioned, there's this mirror imaging or this consistency that needs to happen across a manuscript. You need to have Each table and figure needs to be reflected in the results section of your manuscript, and then it needs to be reflected also in the abstract results. And then when you look to the methods have to analogously describe how that information was obtained. So I lay this out in a very systematic way because I think everyone, people become accustomed to sort of hearing pieces of data in a specific order. And if you don't hear it in that order, it can be jarring for the readers because then they spend a lot of time saying, okay, well, I was expecting to figure out here how they did their multivariate analyses. And if that data is not there, then you start going searching, trying to figure out, well, how did they get to this data? But if you present this in a very logical and consistent and sort of well laid out format, it makes it very easier for the reader to kind of receive the information that you are presenting. And again, that helps with the transparent reporting and the efficiency of your reporting. Now, figures and tables are critical. As I said, that's actually the heart of your paper. So when you're preparing figures, I want you to ask yourself, first of all, do I even need a figure for this finding? Then you ask, well, what's the best figure to synthesize the data that I'm trying to present? Is the most important data still in my text? That's really critical because you definitely want to have the necessary tables and figures, but you want your reader to be able to not have to go hunting and searching for that one piece of data that obviously is maybe the most important finding in your paper. It needs to be addressed in the text of the results. And then I would argue you need to make your figures really beautiful because they need to be visually impactful. And I want to highlight and point you towards the guidelines for reporting of figures and tables that have been presented and were developed by the statistical review team from European Urology, because I think this can really help you to ensure that you're presenting your figures in the most efficient and effective way possible. Your tables and figures need to be logical. They need to follow, again, that formatting of who's your study about, what was the independent variable, what's the dependent variable, and then what are all the other sub-analyses. You don't want to get into these subset analyses before you've presented sort of the most basic data about who your study's about. Critically, please, as a plea, I would say that every table and figure needs a legend. Everything needs to be clear and appropriately laid out. If you use abbreviations, make sure you define them. And then think visually. When we think about figures, you want to use figures to synthesize critical pieces of data and make it easier for your reader to understand those pieces of data. And then this is also where you highlight the critical findings of your study. So let's just take a couple of minutes to think about how we can prepare figures for maximum impact. So the first thing is, when you're looking at a piece of data that you need to discuss, ask yourself, do I need a figure? Does the figure improve the reader's understanding of your findings? So take a very simple example here. This is a bar chart that was presented showing the volume of patients presenting with different stages of cancer. Now, I would submit to you that given that we only get usually about 6 tables and figures for every manuscript we present, depending a little bit on the journal guidelines, you may not want to use one of those critical tables or figures here for something that otherwise could simply be presented in a very straightforward table or in a simple sentence where you just said the prevalence of stage 1, 2, 3, and 4 cancer was 14, 33, 34, and 20% respectively. And then use that table or figure to present something that's maybe a little bit more of a complex concept. Similarly, you do want to make sure that when you're presenting your figure, you're choosing the right figure to present the data. So a lot of times people, I think, fall back on sort of the default figures that, for example, Excel or PowerPoint automatically allow us to create. But I think that one thing that can be important is look at it and say, does it help my reader to really quickly understand the patterns in the data if I present this figure? So these 3D box charts actually are kind of hard to read. And maybe a simpler way here that really allows your reader to more quickly grasp patterns in data. For example, if you're looking at changes in kidney function score between 2 drugs over different ages, is to use this scatter plot that then has the sort of the lines of fit of the data, because you can start to see how the different drugs have different patterns across age in a much clearer way than, for example, this shows. Another thing I want you to think about is how to make a visually pleasant and easy to understand figure that really does highlight key findings or key patterns in your data. So one of the things that we all do is we all read from left to right. Necessarily, our brains are kind of programmed to synthesize and understand data in that way. So for example, here, if you're looking at two different arms of a study and you're comparing complications in two geographical areas, this figure here on the left doesn't really help a reader quickly understand where the differences lie. But if we, for example, sort the data and present it in a left to right fashion, we can all of a sudden start to see these patterns much more clearly, and that can really help your reader understand the points that you need to make. It's also important that you use a format that is easy to read. And so, for example, making sure that you use colors that stand out and not have too many lines like this one. This scatter plot is incredibly challenging to draw any conclusions from. But you can see that a figure like this, which looks at intact to free PSA ratios across different cohorts, is really clear. You can see the sort of the similarities and the variation in the distribution of the data. It's color-coded. It's very easy to quickly read and accurately take a look at. And then, of course, these are just some other key points from the guidelines that I highlighted. And I do want you to take a moment and take a look at those, but clearly label your axes. It's important that we report percentages and not proportions when we're talking about people. You want to be consistent in terms of your font, your colors across figures and tables. Definitely think about adding distributions. And when you're presenting Kaplan-Meier curves, use color, ensure you include your numbers at risk. This is just going to reduce the number of revisions that you have to respond to from the statistical reviewers about how the data is presented. And then I think that you'll see there's more information from Dr. Vickers, who's one of the heads of our statistical review team at European. If you read his paper, he really makes some nice points about sort of avoiding the types of figures that don't really convey data in a really rich and meaningful way, such as pie charts, and then being thoughtful about how we really understand the validity of the data. So for example, if your median follow-up is only 2 years, don't present Kaplan-Meier's out to 10 years, because the ends, the tails in those figures is going to be incredibly unstable. It's going to present data that really doesn't have a lot of specificity or precision. So you can simply just truncate the Kaplan-Meier curves at that point. And of course, description is critical. Make sure things are transparent. Make sure you have a title and a legend that fits your data. Similarly, when you're presenting tables, keep it simple. Try to collapse when you can different variables. If you only have two layers to your two levels to your variable, we can all do subtraction. So simply present the single level, and then by necessity, your reader can understand that if women comprise 25% of your study sample, then men in your study will have comprised 75%. Keep everything nice and clean in terms of its alignment, and avoid repeating all of the data in the tables in your text. So just highlight, you can make sure all the data is there, and then use the results text to really highlight the most important findings that you want your reader to take home. I think it's also important when you can sort of collapse categories to do so, because that helps to declutter your tables. And then it's really important to be transparent. So for example, if you have 200 patients in your study, but one of your variables you only had data on in 150 of those patients, make sure that you highlight that somewhere, because otherwise your reader is going to be trying to figure out why the proportions don't match or the percentages don't match, and that gets confusing. And here's just an example from one of my studies. So this was a table where we were doing a systematic review. We were evaluating different prehabilitation trials across a specific set of guidelines. And I looked at this table and I said, we just simply can't present this, because if I look at this, it doesn't actually help me to understand the quality or how these different studies scored. So what we did instead is we did it like this, and this is how we ultimately presented it. We sorted our studies into trials and case series, and then we just simply said whether or not each study was able to sort of included the key components that we were looking for, and then gave a final score at the end. And this was a much, I think, clearer way to kind of rapidly convey this data to our readers. So again, when you're presenting your data, you want to be clear and call out your tables and figures. Each table and figure should be referenced in your text. You want to be logical in your organization. Specify the hypotheses that you tested, but don't provide p-values or test hypotheses that aren't critical to the work that you're presenting. And then if you describe an analysis in the methods, make sure you present it in the results. And similarly, if you present a result, be sure you told your reader how you got that data by describing that analysis and in the methods section. In terms of the methods for the methods, this is really where you present your recipe. So this needs to be, your methods need to be clear, concise, and simple. You need to ask yourself, if somebody reads my methods section, could they replicate my study in their patient population? And this is essentially the who, what, when, where, why, and the how, especially the how. So this is going back to the consort statement. The consort guidelines provide really critical checklist for all of the information that needs to go into your methods section if you're looking at, for example, the reporting of a randomized clinical trial with respect to how you design the trial, the participants, the eligibility criteria, and the interventions specifically. Importantly, you need to be sure that the eligibility criteria is clearly laid out. We said that's going to go into the consort flow diagram, but you need to tell your reader who's allowed into your study and who is not, because again, that's going to be important from a generalizability standpoint. When you're describing any interventions or the independent variable, it needs to be clear if you gave a drug, how you gave it, and whether or not at any point the way in which you administered that intervention changed, because again, that could potentially introduce bias. And of course, there's very detailed information that has to go in terms of how you assess sample size, and then ultimately how you randomized and allocated patients to the different arms. And then I think the discussion is something that a lot of writers struggle with. But this is how I approach the discussion in one slide alone. So my first paragraph, I restate my objective. I summarize my main findings. Paragraphs 2, 3, and 4, I contextualize the key findings within the literature. I explain each finding. So each finding gets its own paragraph. We say what it was, but then we say, okay, well, how is this similar or different to what's been presented before? And therefore, what is the impact of the findings that I'm presenting? Paragraph 5, though, is where you really deep dive your limitations. And this is important because this is where you lay out all of the potential reasons why your study might have some faults. And it's important to be comprehensive here because this is what your reviewers are seeking to look for. And if you say my study didn't have any limitations, that automatically reduces the potential sort of validity of what you're presenting. But in paragraph 6, you say, nevertheless, despite these critical limitations, here are the strengths of my study. Here's what we are adding to the literature, and here's where we're going next. And if you do it right, you can actually diffuse a lot of the comments that you're going to receive from the reviewers, because all they can say is, as the writer appropriately noted in their discussion section, these are the critical limitations. This is how they address them. And then I think the conclusion should be very simple. This is where you'll state your key findings one more time. You'll nod to your future directions, but you never want to overstate or overinterpret your data. So I think you have to be a little bit humble and make sure that you're not saying, for example, that you've solved all the problems of the world with your paper, but keep it very, very, very focused. And again, it should only be about 3 or 4 sentences. So if you do this right, and you present your research in a detailed but transparent and organized fashion, I think you maximize the impact of your work. And using these consensus checklists as I've suggested, and as is really mandated by many of the journals at this point, that maximizes the quality of the communication of your work, and it also optimizes the likelihood of the publication, because your reviewers and editors will look to see whether or not you followed these guidelines when you're presenting your work. I also think it's helpful to start early. So one thing I actually do is when I'm writing a study protocol, I actually have those guidelines open on my computer as I'm working through my protocol to make sure, for example, that when it comes time to report the allocation of my patients, I've thought about blinding and how I'm going to randomize and how I'm going to block stratify and things like that, so that I'm actually collecting those data points early, and I don't get to the end of my study and to the point where I'm writing it and I say, oh, I missed that critical piece of information. I didn't actually collect that. It makes the writing process a lot faster. So just to kind of start thinking about wrapping up here, checklists remind us of the minimum necessary steps and make them explicit. They not only offer the possibility of verification, but also instill a kind of discipline of higher performance. And again, that's more from Atul Gawande. But I think that his checklist manifesto is just a great read. But it's helpful, I think, to have these kinds of checklists when you are writing up your papers, because it just makes it that much more straightforward. So just a couple of last slides on the peer review and editorial process. So once you finally write your paper and you get it submitted on the editorial site for the journal that you're looking at, within the first week, your managing editor is going to look at the paper and just make sure that all of the key components have been submitted, and then they'll assign it to an associate editor. That associate editor generally will do an initial review, and it's very unusual that that would be accepted at that point, because for the vast majority of papers, the next process is one of peer review. In some cases, though, we'll realize that we were submitted a paper that maybe doesn't really fit within our context or our priority brief. And so, for example, if it's a really detailed genetics paper that gets submitted to European Urology and isn't necessarily going to meet the needs of our readers, we might suggest transferring it to a more appropriate journal. Sometimes we'll say, we'd like to see this back, but there's so many key issues. I'll request that we'll do a reject and resubmit and say, hey, this brief letter really necessitates a full manuscript formulation, or a full manuscript really only has enough information to sort of support a brief letter. Some papers will be just rejected if they don't meet a priority mandate, but the vast majority will be sent out for review. We generally send them to 6 to 10 reviewers at a time. We'll maybe get 3 reviews back, and then depending on that review, if the reviewers think the paper has merit and that all of the comments that the reviewers are putting forth can be addressed, then we'll request you send us your revisions. And then that revision is really kind of a back and forth dance that can take several weeks to several months as we go back and forth and make sure that that review, that paper is presented in the best possible light. And at the European Urology Journal and its sister journals, we do a complex statistical review at the R2 stage. And then hopefully you get your paper accepted. I think it's important to make sure you read the instructions for submitting authors for the journal that you're submitting to, and follow the instructions. It's just another way of showing the journal that you took the time to prepare your paper as well as you possibly could have. Please proofread your paper. It's something that can maximize the likelihood that your reader is going to take your work seriously. A paper that has a lot of grammatical and spelling errors, unfortunately, can be perceived as not being as serious or as carefully conducted, and it may be just how the work is written. But you want to make sure that your reader understands the amount of work that you put into your study. And then I think it's important to review and respond to any review requests within the deadlines. And I think a lot of times for the statistics, sometimes it helps to have a discussion, and our statistical reviewers are always happy to do so. And then this is something that I wrote for my trainees, but this is kind of how I think about the academic annual life cycle. So I think really, when you're at the AUA, so let's start at the AUA or your big meetings, that's when you kind of start to gather your ideas for the projects that you're going to undertake in the next year. The summer is really where you build your data sets and start your preliminary analyses. A lot of times the fall meetings tend to be the subspecialty meetings or the smaller regional meetings, and that's where you might first submit your work so that it can have a first round of review. And then in the winter time is where you really finalize your analyses and tables and get your paper ready for submission, so that hopefully in the spring you're presenting it at your national meeting and you're writing and submitting the manuscripts, and then you rinse and repeat. And this is really, I think, a sort of a nice way to kind of think about making sure that you're maximizing your productivity on an annual basis. So at the end of the day, the research process it's one of hard work, right? You pour your blood, sweat, and tears into the papers, the projects that you undertake, the research you do, and the papers that you write. For me, I want to make your writing process as easy as possible. And this is how I teach my students and my residents to write, with the goal of creating a final product that really walks your reader down the garden path, maximizes the likelihood that the maximum number of people are going to interact with your work and be able to draw from the conclusions that you understood, and also make sure that you reach as many people as possible. So with that, I'll say thank you very much for your attention, and I would be happy to entertain any questions. Let me just stop sharing my screen here.